Welcome to Ask the Experts. I'm here with Dr. Mark Sullivan, a surgeon at Meritus Medical Center, and we are talking about video-assisted thoracoscopic surgery?
Yes, video-assisted thoracoscopic surgery.
Okay. And what is that?
Well, it's a form of minimally invasive surgery that everyone talks about. Thoracoscopic surgery, which is surgery of the thorax. Laparoscopic surgery, which would be surgery of the abdomen. Technology now is used to provide cameras with magnification that can be introduced into almost any body cavity now, the chest or the abdomen, which gives excellent visualization and magnification. So we do surgeries now in minimally invasive ways that used to require open incisions.
Okay. What kind of surgeries can this be used on?
Surgery of the lung, lung tumors, benign diseases of the lung that affect the lung, which require either diagnostic procedures, which usually involve biopsies, or actual, what we would call pulmonary resections, lung resections, where we can remove a piece of lung or the entire lobe. We call that thoracoscopic lobectomy, which would be the treatment of choice for lung cancer. And
you can remove whole sections minimally invasively?
Yes.
And how large is the incision for something like this?
It can vary either from really just large enough to accommodate the scope itself to anywhere to 2 inches to create what we call a small utility incision, which would be an incision that may be required to actually remove the specimen from the chest after it has been resected. Instruments have been designed to actually work through what we call thoracoscopic ports, just access portals where instruments can be introduced through a little skin nick into the chest.
Okay, so when you're doing a video-assisted surgery like this, you're actually looking at a screen because the camera is inside.
That's correct. Not only can the operating surgeon visualize what's going on, everyone else in the operating room, including the anesthesia personnel, can be watching the operation while it's being conducted. And it makes it also good for training purposes.
It sounds like there are a lot of benefits to this.
Yeah, the recovery time and the recovery period is much, much less. Some surgeries can even be done now on what's classified as an outpatient basis. Basically, you would come in for the surgery and go home on the same day. There's considerably less pain and discomfort associated with minimally invasive surgeries, which also speeds and hastens recovery because people can jump back to their normal level of activity so much faster because they're not limited by pain and discomfort. And also there's quite a bit of data to show that postoperative infections and other types of former postoperative complications associated with certain procedures have been lessened, and some of the data indicates that because there may be some improved immune function associated with a minimally invasive surgery as opposed to a former open surgery. Okay.
What about length of surgery? Is the length of surgery decreasing with the amount of technology that we have, the time of surgery?
In certain aspects, yes, it is almost certainly decreasing. In other aspects, the length of time may be the same, in some cases possibly a little bit longer, but of course any added time in terms of allowing to doing something in a minimally invasive way ultimately translates into a shorter length of stay and less pain and discomfort. So overall the time involved is quite less.
And overall outcome of the patient, are they higher with this video-assisted minimally invasive?
The benchmark for any minimally invasive surgery is, for instance, let's just give cancer surgery as an example. It has to have the same or better outcome in terms of cancer cure rates, resectability, freedom from recurrence of tumor that the open procedure does. So it has to always be held to that standard.
Okay.
And all of the studies that have been used to examine and to assess whether a certain procedure should or should not be done in a minimally invasive way have been compared to the preceding historical surgeries that have been done in an open manner.
Wow, this sounds great. It sounds really futuristic. Technology is an amazing thing.
It is. It really is. It is very, very beneficial and fortunate that the technologies that exist today have been able to be applied to the field of medicine so that we can utilize and take advantage of some of the technologies that have shown promise in other sectors.
Thank you so much for coming to visit us. We really appreciate it. I learned a lot.
Thank you very much. Appreciate the opportunity to speak with your audience.